Hello, assalamu alaikum. This is me, Dr. Jahangir Khan, and today I'm going to start the July papers, the SK10. Sorry for the delay. I was busy for the last 2 to 3 days. That's why I didn't upload a video. So I will be trying to increase my speed to cover the medicine paper as soon as possible, so we can shift to the other specialties as well. Well, these MCQs are for all specialties because the main thing, the main MCQs, the main bank is the same. There is only shuffling of the MCQs. So coming toward the MCQ, that is in case of dehydration, ESF will be, the answer is hypertonic. The ESF will be hypertonic because in dehydration your solutes are not evaporated, or they are preserved, or they are not that much lost, but the fluid is lost. But if the question says the fluid as well as solutes are lost, and the solute loss is more as compared to the fluid, then it is hypotonic. If the solute loss is more as compared to the fluid, then this is hypotonic. If the fluid loss is more than the solute, then this is hypertonic. But if there is no such thing mentioned in the stem, that there is a loss of solute more or solvent more, then you have to choose the hypertonic. ESF will hypertonic. Well, there is another MCQ. I want to clear that MCQ right now. In the previous lectures, we talked about the thirst center. The thirst center is stimulated by the ICF dehydration or the ECF dehydration. Well, the answer to that I shared on my Facebook page as well as on my YouTube channel with the reference that is from the Guyton. So that MCQ, that the thirst center is stimulated by the ICF dehydration in the hypothalamus. ICF dehydration in the hypothalamus or thirst center. ICF dehydration in the hypothalamus or thirst center, when that is stimulated. How is that stimulated? It is due to the dehydration of that osmoregulator in the hypothalamus. If that is not in the option, then the next option is the ECF dehydration, or the increase in osmolarity of the ECF. Then the next best option is the ECF dehydration. If you are having two options, one is the ICF dehydration, other is ECF dehydration, you have to choose the ECF dehydration, because it is only the ICF dehydration in the hypothalamus that activates the thirst center. So coming next, अगर इस तरह पूछ ले कि एक्शन पोटेंशियल इन द हाइपोथैलेमस in the thirst center is generated due to ICF dehydration. ये ICF dehydration leads to the impulse generation. Most common site of fracture is the angle. Which of the following structure lies interior to the trachea and thoracic cavity? There is the arch of aorta lies interior to the trachea in the thoracic cavity. So you are having the arch of aorta. The arch of aorta. आगे बढ़ते हैं. Which of the following is a gene amplification tumor involved? So this is a neuroblastoma, and the name of the gene is the NMYC gene. So there is amplification of the NMYC gene. Juvenile polyposis syndrome, this is hematomatous. ये याद रखें. The hematomatous juvenile polyposis, the hematomatous polyps. Which of the following carries the highest risk of pre-malignancy, or which of the following carries highest risk to conversion to malignancy? तो adenomatous polyps है आपका. Adenomatous polyps. Posterior pituitary is derived from the neuroectoderm of the diencephalon. The neuroectoderm of the diencephalon. So if you are having a pituitary gland, you are having the posterior, you are having the interior. So that is developed from the diencephalon, while that is developed from the roof of the from the oral ectoderm. Let's suppose this is your pituitary, interior pituitary and posterior. So this is developed from the neuroectoderm of the diencephalon, while the interior pituitary is developed from the this is oral ectoderm. This is oral cavity. From that there is ectoderm, which goes upwards and form interior pituitary. Patient plan to undergo surgery in a given cimetidine. So cimetidine is going to decrease the secretion volume, and we are interested to decrease the gastric volume. Why? To prevent aspiration. A diabetic patient with mixed edema. अब यहाँ पे confusion समझ लें, यहाँ पे concept समझ लें. What is mixed edema? What is mixed edema, comma, and what is pretibial mixed edema? The term pretibial mixed edema mean the edema, the non-pitting edema in the shin area or the lower limb area in case of hyperthyroidism. The pretibial mixed edema is in case of hyperthyroidism. Well, the next thing mainly is the mixed edema coma is due to severe hypothyroidism. The person is in a coma. The next thing is only mixed edema, then this is hypothyroidism. And in mixed edema coma or in the pretibial mixed edema or whatever the mixed edema, what is the basic pathology? That is the accumulation of polysaccharides, hyaluronic acid, accumulation of hyaluronic acid. So that leads to the fluid, that is the polysaccharide, and that polysaccharide actually draws water and causes the swelling. So यहाँ पे पूछ रहे हैं कि a person is having hypothyroidism and he is having hypertension. So what is the cause of hypertension and diastolic? What hypertension is most common in hypothyroidism? The answer is diastolic hypertension. Next question is, what hypertension is most common in hyperthyroidism? The answer is systolic hypertension. The answer is systolic hypertension, and we call that is isolated systolic hypertension. And in the hypothyroidism, we call that isolated diastolic hypertension. And what is the reason for in diastolic hypertension and hypothyroidism? The answer is atherosclerosis. Suppose this is your vessel. What happened in hypothyroidism? The clearance of the LDL in the liver, that is decreased. Why that is decreased? This is another MCQ. Because of the decreased expression of the LDL receptor in the liver. So whenever the LDL, it goes up in the blood because of decreased clearance by the liver. In case of hypothyroidism, what happens? The LDL deposits in the vessel, and it causes increased thickening of the vessel wall. If it is causing increased thickening of the vessel wall, this is called atherosclerosis, and it is increasing resistance. And we have studied that the marker for diastolic hypertension is increased resistance. So that is why it leads to diastolic hypertension. Why hyperthyroidism leads to systolic hypertension? Because of increase in the heart rate. Suppose this is the heart, increase in the heart rate and increasing the cardiac, increasing the stroke volume. So the cardiac output is equal to heart rate into stroke volume. So we also know that if the cardiac output is increasing, it is increasing your systolic hypertension. So what will be the treatment of choice for hypertension in hyperthyroidism? The answer is beta blocker, especially the non-selective propranolol. And what is the treatment of choice or the modality of choice? The treatment for hypertension and diastolic, the answer is AC inhibitor or vasodilator. AC inhibitor or vasodilator. So यहाँ पे आपने captopril choose करना है. The answer is captopril. So coming next, 70-year-old hypertensive that was diagnosed with thyroid. You see, इसके बाद डायरेक्ट आ गई MCQ. That is propranolol, because this is thyrotoxicosis. A child presented. What is the difference between hyperthyroidism and thyrotoxicosis? In both you are having, in both of these conditions, you are having the biochemical picture of hyperthyroidism. You are having the decreased TSH, but actually you are having increased T3 and T4. In both of the hyperthyroidism and thyrotoxicosis, you are having increased T3 and increase T4. But what is the main difference? In thyrotoxicosis, there is endogenous production of T3 and T4. That is the problem. In thyrotoxicosis, your gland is active, and in hyperthyroidism, this is actually not due to increased activity of the gland. This is due to increased activity of the drug you are taking, such as thyroxine. So you have to keep this differentiation in mind. This is usually asked in YOA, and this can come in MCQ. So the difference between hyperthyroidism and thyrotoxicosis: in thyrotoxicosis, your gland is actively secreting the hormone T3 and T4, leading to hyperthyroidism, while in hyperthyroidism, it is not the increase in the gland activity, it is the drugs that a person is taking, such as levothyroxine, that is causing the feature of hyperthyroidism. So a child presented with rigors and chills taking treatment now develops dark urine. If we remove this taking treatment and the child presents with rigors and chills and develops dark urine, the answer will be falciparum malaria. But if you include taking treatment, then the answer is G6PD deficiency. Which drug has action similar to atropine? Scopolamine. And this is the same drug by the name of Buscopan. A majority of people are using this just for abdominal pain. Well, it causes a constipation and it causes a glaucoma. It causes glaucoma. That is it causes the angle. It causes pupillary dilatation. Whenever there is pupillary dilatation, what happens? The canal of Schlemm that is blocked. So with the pupil margin, you have blocked the canal of Schlemm, so there is decreased clearance of the aqueous humor from the interior and posterior chamber. If there is decreased clearance of the aqueous humor because you have pressed the canal of Schlemm, so what happens? There is closure angle glaucoma in the old age, and it leads to urinary retention due to prostate in the old age, and it leads to the constipation because of the anticholinergic effects, and it leads to the dry skin. All of these are actually the manifestation of atropine. So better to avoid the scopolamine in clinical practice. Try to use the safer drug, this more selective drug, like the NOSPA, the ZSPA. They are more selective. Coming next, what is the most commonly artery involved? Already discussed in my previous lectures. Posterior descending artery, and if that is not in the option, then right coronary artery. The findings seen in the cardiac tamponade is, now you see, this is the pulsus paradoxus. Pulsus paradoxus is actually a misnomer. This is not a pulse, this is pressure. Point number 1. Point number 2, during inspiration your BP drops by 10 mm. But if it is dropped by more than 10 mm during inspiration, then this is called the pulsus paradoxus is positive. And this is a pathognomonic sign of cardiac tamponade, tamponade. Now the Kussmaul sign is positive in this. What is the Kussmaul sign? Let's suppose this is the heart and this is the jugular system attached to the right atrium. Normally when you inspire, what happens? The negative pressure inside the thoracic cavity, it increases, or you can say the pressure inside the cavity, it decreases. Now I have already discussed, if you talk about the negative intrathoracic pressure, that is increasing, but if you are talking about only thoracic pressure, that is decreasing. एक बंदे पे 70 रुपये कर्ज है, उसने 30 और ले लिए, तो उसने कर्ज इंक्रीज किया या डिक्रीज किया? वो ज़्यादा कर्जदार हो गया, -70 to -100. So if you talking about negativity, whenever a person inspire, what happens? The thoracic diameter increases. There is a vacuum inside the thoracic cavity, so the negative intrathoracic pressure increases, but the thoracic pressure actually decreases. It becomes more negative if you remove the word negative. तो क्या होता है? तो जब आपका the pressure drops inside thoracic cavity, when the pressure drops inside the thoracic cavity, what happens? The thoracic cavity, when the pressure drops, so there is a increased diameter of thoracic cavity. When there is increased diameter of thoracic cavity, the lung expands. When the lung expands, I have already discussed the vasculature inside the lungs that also dilates. Whenever the vasculature inside the lung that also dilates, there is decreased resistance inside the pulmonary vasculature. Whenever there is decreased resistance inside the lungs and pulmonary vasculature, there is emptying of the right ventricle and the blood suddenly goes to the lungs. When the blood suddenly goes to the lungs, what happens? The blood inside the jugular system that falls rapidly. So this is the mechanism during inspiration why the JVP falls. This is the normal phenomena. If you understand this, you will understand the pathology. During inspiration, your JVP falls. Why? Because of this mechanism I talked right now. Because of the negative intrathoracic pressure, the increase in the expansion in the lung volume. Whenever the lungs are expanded, what happens? The blood vessels along the alveoli, they also become dilate. When all the vessels in the lungs are dilated, what happens? The resistance inside the pulmonary vasculature that drops. When that drops, the right ventricle pressure also drops because the blood quickly moves into those vessels. When the blood quickly moves into those vessels, there is vacuum created in the right ventricle. So to fill that vacuum into the right ventricle, what happens? The blood suddenly falls from the jugular system, the internal jugular vein and external jugular vein, and you are having fall in the JVP during inspiration. During expiration, the reverse process happens. Now, if you are having fluid in the pericardial cavity, that is called cardiac tamponade, so can you expand this If you cannot expand the right ventricle, can you create vacuum? No, you cannot create vacuum. If you cannot create vacuum, what happens during inspiration? Your JVP actually increases. Now this is a very important sign. You can clinically assess this patient during inspiration. Normally what happens, JVP falls, but in this patient you are having fluid inside the pericardium, and the heart is unable to expand. When the heart is unable to expand during inspiration, the JVP goes up. That is pathognomonic for the cardiac tamponade. Because if this is your heart, if this is your pericardial cavity, if there is a fluid in it, what happens? It will compress the right ventricle more as compared to the left, because the right is less muscular, so the volume of the right ventricle is further decreased. Wide mediastinum is usually seen in the aortic dissection and the lymphadenopathy and the teratoma. There are 5 T's. That is for the wide mediastinum. There is actually a white cardiac shadow in the case of cardiac tamponade, and that is a bottle sign. That is called the bottle sign. The heart looks like the bottle, and the steep wide descent is absent. Now there is a video on my channel regarding cardiac cycle 1, 2 and 3. There are 3 parts, and I have discussed the correlation. So if you see, this is your A wave, this is the JVP tracing, this is your X descent, this is your C wave, and then this is your V wave, and then this is your Y descent. Now coming toward the Y descent, I will not go into the detail, you can watch the video from there. Now the rapid Y descent I have explained diagrammatically. The rapid Y descent is there because of the cardiac tamponade. This is the rapid Y descent. The rapid Y descent is due to or the steep Y descent is due to the cardiac tamponade, because the pericardial fluid that is not allowing the heart to dilate. So if that is not allowing the heart to dilate, so what happens, there is a quickly filling of the ventricles, and you will see there is a sound called knock sound. That is called pericardial knock. You can see an examination, and that knock is due to the decreased dilatation of the pericardium. So the steep Y descent is on JVP, that is present, that is not absent, that is positive. So over here the answer is pulsus paradoxus. A disoriented was brought in the ER by his wife with the complaints of right flank pain and vomiting. Diagnosed. Now you have diagnosed a patient with acute appendicitis, and the patient is unable to give you a consent for surgery. So you can take a consent from the closest person to him. So the answer over here is the take consent from the wife. Loudest one, opening and mild diastolic rumble, murmur at apex are characteristic. ये तो बिल्कुल SOPD है. So what is SOPD? So you are having loudest one, the opening snap and the diastolic rumble. That is the SOPD. That is for mitral stenosis. Loudest one, opening snap, diastolic rumble. In CKD patients, anemia is due to erythropoietin deficiency. Already discussed in details. If you are what is erythropoietin resistant anemia in CKD? Well, there are a lot of causes, but for CPSP purpose, as far as the CPSP bank is concerned, you should think of iron deficiency anemia. The iron deficiency anemia, you should think of that. Patient diagnosed as a case of AIDS. Tell patient only, not family. Tell family. Tell family, not patient. Tell family and patient. Now you have to break this news to the patient and wife. Patient and wife. That is the right answer. The right answer is missing. You have to inform the patient as well as the wife, because the wife is at risk. If the patient is not allowing you to tell to the wife, then you have to breach the confidentiality in this case. You are not supposed to keep this news hidden. You are supposed to talk to the wife that this person is having AIDS, HIV, and you have to take precautionary measures. That is the main answer, because the wife is at risk of acquiring, and this is actually STD, transmitted sexually. So the family is not at risk. So this is the wife. But if that is not in the answer, the right answer over here is still only the patient, not the family. Trypsinogen is activated to trypsin by increase in pH, and that is why there is increase in the intestine. pH is high. A patient with atopic gastritis, simple MCQ, B12, already discussed regarding the antibodies, the anti-intrinsic antibody, antiparietal cell antibodies, discussed in detail which one is specific, which one is sensitive. You will see. So anti-intrinsic factor antibodies are most specific, but mostly found in patient is antiparietal, but that is not specific. An old man presented with subdural hematoma. This is due to superior cerebral vein. It is not cerebellar vein. Focus on the option superior cerebellar vein, because most of the time the person is anxious, and when the person is anxious, his subconscious mind is working, the conscious mind is not working. So if your subconscious mind is working and you have programmed your subconscious mind by the quickly picking the answer, so you may miss the right answer. So you keep your conscious mind active during exam, and this is done by the by focusing on your breathing pattern and not taking the anxiety. So here you have to focus on superior cerebellar. It is not superior cerebral, it is superior cerebral vein. So coming next, exotoxin is in food poisoning is due to which organism? That is Staph aureus. That's why we treat it conservatively. There is no role of antibiotics, because we are having only toxin, not the organism. Hypersensitivity is most commonly organism. Which are the following organism? That is Mycobacterium tuberculosis, and this is called type 4 hypersensitivity reaction. Submental and submandibular lymph node drains into the lower lip. But there is MCQ that was shared by me in the mock exam as well. If there is bilateral enlargement of submental and submandibular, then the diagnosis is lesion or the carcinoma of the interior two-third of the tongue. But if you are having unilateral finding, then lower lip. Part of nephron impermeable to water is your ascending loop of Henle, and that is permeable to sodium chloride and potassium. That is permeable to sodium chloride and potassium. And this is the mechanism, the loop of Henle. This is called counter current multiplier. Counter current multiplier is seen in loop of Henle. This is counter current multiplier, and counter current exchange is seen in vasa recta, vascular system. Vasa recta. These two are the bonus MCQs that are highly repeated regarding the mechanism. Well, this is not the time for me to explain the mechanism of these two things. I will explain later on, but right now the time is short. You have to keep these two MCQs in mind as well. What are the following? So the descending loop of Henle and the ascending limb of loop of Henle. The descending, this is permeable only to water, and the ascending, this is only permeable to solutes and completely impermeable to water. And you are having increased osmolarity over here. Osmolarity over here is equal to the osmolarity outside, almost 1200. This is the maximum osmolarity the urine can gain, 1200. Which of the following factor is activated in the lungs? So the answer is angiotensin 2. So you are having angiotensinogen that is converted into angiotensin 1 by renin. Then the angiotensin 1 to angiotensin 2 is converted into the lungs. That is the endothelium of the lungs. There is the enzyme called ACE, angiotensin converting enzyme. So that converts 1 to 2, and then the 2 causes its activity, causes increasing blood pressure and blah blah blah. Which the following is neural crystal derivative? The answer is dorsal root ganglion. Coming next, I will be quickly go through the things so that things are more and more things are covered in a shorter period of time. So you are having child having erythroblastosis fetalis, and the blood group A positive, need blood transfusion. Which blood to be given? The answer is C. You are supposed to give the A negative drug. The most common cause of erythroblastosis fetalis is there is the RH incompatibility. So if you are not given the that this is RH incompatibility or ABO incompatibility, because the RH incompatibility is also causing this erythroblastosis and the erythroblastosis fetalis, and the ABO incompatibility also responsible for this. But the severe cases are caused by the RH incompatibility. So you are supposed to give such blood which are having no antigen. So the A negative is right option over here. If you are having the RH incompatibility, remember this, if you are having RH incompatibility, what blood group is ideal for the transfusion in the baby? The answer is RH of the mother, ABO of the baby. Rationalize it. RH of the mother, ABO of the baby. RH of the mother, ABO of the baby. If you are having the ABO incompatibility, what transfusion will you give? The answer is ABO of the mother and RH of the baby. ABO of the mother and RH of the baby. If you memorize this simple rule, inshallah, you will pick the right answer in the exam. So the RH incompatibility, the first thing goes to the mother. RH incompatibility, RH of the mother, ABO of the baby. ABO incompatibility, the first thing goes to the mother, ABO of the baby, ABO of the mother and RH of the baby. And there is another MCQ. A person is having severe anemia. There is anemia of hemolytic anemia of the newborn. You will transfuse which blood? That is leukodepleted RBC. Leukodepleted RBC. That is cross match with the mother blood. Cross match with the mother blood. Ye zara yaad rakhe. Cross match with the mother serum, not the blood. Leukodepleted RBC negative, that will be negative, so that will be RH negative, and cross match with the mother serum. Cross match with the mother serum, not the baby serum, the mother serum. I have shared the reference on my Facebook page. You can watch it from there. The whole MCQ, you can watch it from there. And you should keep these things in mind. These are the minor thing, but you should study the stem properly. You should study the stem properly, and that is the reason most of the time we do blunders, because we are not giving proper attention to the stem. And inshallah, majority of the things will be repeated from these MCQs. If you study these MCQs like I am preparing you for them. So the answer over here is A negative. The answer over here is A negative. Why? Because if we presume this is RH incompatibility, you have to take the RH of the mother and ABO of the baby. Because erythroblastosis vitellis, this is most severe in the RH incompatibility, or most common cause you can say is RH incompatibility. So if you are taking RH of the mother, so what is the RH of the mother? The answer is negative. And if you are taking the ABO of the baby, what is the ABO of the baby? The answer is A. So you transfuse with A negative. Young female present with gum bleeding fever. Now you are having fever that shows problem with WBC. You can see goes down. Gum bleeding, you are having problem with the platelet, goes down. And there may be a mentioning of anemia. So this is actually pancytopenia or bicytopenia. So for bicytopenia and pancytopenia, the diagnosis of choice is bone marrow biopsy. Answer is B. If the question says best initial, so the best initial or the next step is not biopsy. The next step or the best initial is CBC or peripheral smear. If there is peripheral smear, you should go for peripheral smear. The same scenario, but the word is best initial or the word is best next step. तो next step में आपका CBC peripheral smear होगा. Peripheral smear नहीं है तो CBC. लेकिन यहाँ पे है best way to diagnose. The best way to diagnose the bicytopenia or the pancytopenia is to go for bone marrow biopsy. Intraembryonic coelom derivative of, that is the lateral plate mesoderm. The lateral plate mesoderm. That is actually the lateral plate mesoderm. So you are having the axial mesoderm, you are having the intermediate mesoderm bilaterally, and you are having the lateral plate mesoderm. So what happens? These lateral plate mesoderm, they join together and form the intraembryonic coelom. This is the intraembryonic coelom, and this gave rise to the pericardial cavity, to the pleural cavity, and the peritoneal cavity. So the three cavities inside the body, they are derived from the intraembryonic coelom, and the intraembryonic coelom itself is derived from the lateral plate mesoderm. You should keep this thing in mind. And the lateral plate mesoderm, lateral plate mesoderm, lateral plate mesoderm. So over here the extraembryonic mesoderm, that is formed from the epiblast, but the extraembryonic coelom is formed by the hypoblast. Which artery is posterior to sternum? The answer is internal thoracic artery. And the aorta is actually lies very posteriorly. That is actually lying posterior to the other structures. So immediately posteriorly you are having the internal thoracic artery. A child suffering from nephrotic syndrome having protein of 3 gram. Cause of edema is decrease on cortex pressure. That is the right answer regarding the edema. And this is a favorite CPSP question, the mechanism and the causes of edema. And I have uploaded all of the causes on my Facebook page. 50-year-old female after mastectomy present with right arm swelling, that is lymphatic obstruction. Diagnosis in patient with meningitis is, so that is penicillin G, Cell death is known as apoptosis. In Banu, you are having a patient, fever, lymphadenopathy, hepatosplenomegaly, fatigue, Kala-Azar. That is a type of leishmaniasis, and the causative organism is the sand fly. Destruction of the supraoptic nuclei of the brain will produce. So supraoptic nucleus controls the water. So there is the water balance. So you are having diabetes insipidus. So increased urinary volume and a very dilute urine. Why? Because the DH is not working. If the DH is not working, so it cannot absorb water. If it cannot absorb water, so you are having more urine. If you are having more urine, it will be more dilute, and the specific gravity will be low. Specific gravity of urine will be low, plasma would be high. What is the normal osmolarity of the blood plasma? Answer is 270 to 300. What is the normal osmolarity of the urine? The answer is 350 to 1000. Why? Normally, the urine osmolarity is usually high as compared to the plasma. Why? Because of the formation of urine. If the urine osmolarity is less, than that of the plasma, then it will causes the problem I have discussed in my previous videos. But this is not the time to discuss those things. But you are supposed to memorize these things. The normal osmolarity of the plasma is 270 to 300, while the normal osmolarity of the urine is 350 to 1000. And if more than 1000, then this is abnormal. What can be the maximum osmolarity of urine? Maximum osmolarity urine की क्या हो सकती है? That is 1200, not more than that. Which of the following is preferred treatment for warfarin toxicity? The answer is Fcps. And if asked what is the antidote of warfarin, the answer is vitamin K. A 27-year-old woman presented with the complaints of weight gain, amenorrhea, and fatigue. Last year, she experienced a complicated delivery requirement. Now, if you are having a delivery and there is more blood loss, so your pituitary is going to be compromised. If your pituitary is going to be compromised, this is called hypopituitarism, and this syndrome is called Shihan Syndrome. So you are having hypothyroidism and all the feature of the pituitary insufficiency, discussed in details in my previous lecture. Sensitive test for SLE is ANA, while specific anti-smooth, and if that is not an option, then anti-double stranded DNA antibodies. 70-year-old man with renal transplant 2 years back, now presented with complicated pneumonia, not responding to antibiotic. Lewash shows the boat-shaped crystal. The answer is Pneumocystis carinii or the Pneumocystis cerevisiae. These two are the same thing. This is a fungus, and the unusual thing is that it responds to the antibiotic, not the antifungal. That is the Cepron-DS. That is the cotrimoxazole. In a forceful flexion of the neck, which ligament is torn? So there is a rule for the ligament tear that the ligament to the that opposes the movement at the joint will be turned. Let's suppose this is the neck of the patient, and this is the front. If there is a flexion, the nuchal ligament will be ruptured. If you are extending it, there will be anterior longitudinal ligament that will be ruptured. So the ligament that causes the limitation of the movement would be ruptured in the movement against it. So in the forceful flexion of the neck, ligament nuchae, and extension, that is anterior longitudinal. Fractured neck of the fibula, common peroneal nerve is the right answer, because the common peroneal nerve goes through the neck of the fibula. Let's suppose if this is the head and this is the neck of the fibula and this is the tibia, so the common peroneal nerve comes over here. So if you are fracturing with this, you are actually destroying that nerve. So about hyaline membrane disease, is a disease of prematurity, is called disease of prematurity. So it is a commonly seen in prematurity, and this is called neonatal respiratory distress syndrome. Landmark of descending aorta is, so that is actually a T4. Damage to TMJ causing difficulty in opening of the mouth. So lateral guide usually open the mouth. If that is your mouth is not opening, then that is the answer. Complement system, because complements are protein that are formed by the hepatocytes. So in the CLD, the complement system is compromised. Which of the following have low? If the complement system is compromised in the CLD, so you're having decreased opsonization and decreased immunity, so that leads to SBP, one of the cause of the SBP. Which of the following having low complement level? The answer is SLE. So you're having C3 complement and C4. In SLE, you are having 3 words, 3 alphabets. In hepatitis C, if you write like this, there are 4. 1, 2, 3, 4. So in hepatitis C, so you are having the C4 is complement C4 is going to be down. In this SLE, complement C3 is going to be down. C4 and C3. Most common cause of cirrhosis in male, the answer is hepatitis C. The answer is hepatitis C. Sharing the reference with you. Hepatitis C is now the most common cause of cirrhosis in the US. So it means in the worldwide it was the chronic hepatitis C is the most common cause. Now the US itself is saying that chronic hepatitis C is the most common cause of cirrhosis in the US. So now this MCQ is now cleared from the USMLE point of view, from the US point of view. In the worldwide, we already knew that chronic hepatitis C is the most common cause, but we were of the view that in US alcoholism is the most common cause. So I would go with the hepatitis C. Worldwide hepatitis C. Worldwide hepatitis C. In the US hepatitis C. In the US hepatitis C. But if the word European countries is mentioned, European countries, then alcoholism. In Europe and in European countries, then alcoholism. In the US, chronic hepatitis C. Worldwide hepatitis C. Most common cause of cirrhosis, that is hepatitis C. अगर इस तरह हो most common cause of cirrhosis, तो answer is chronic hepatitis C. Coming back. So a child with the diphtheria toxoid already discussed. Type 3 most locally spreading tumor basal cell carcinoma. अगर वो नहीं है तो then ameloblastoma already discussed in detail. Mitochondria abundant in apical cells. अगर apical cell mention है तो already discussed. Ciliated cell अगर apical नहीं है तो फिर skeletal है. Discuss किया है मैंने detail के साथ in the previous lecture. What is the following definitive detection method for ovulation? So they are talking about definitive detection method. So furring of the cervical mucosa. So furring of cervical furring of cervical mucus is seen in two things. It confirms the amniotic fluid, so premature rupture of membrane, if there is any, it will detect and it detects your ovulation. Most common premalignant lesion of oral cavity, that is leukoplakia, and mostly there is erythroplakia. Insulin independent, इस पे फोकस करना है, एग्जाम में ये गलती ना करो. इंसुलिन डिपेंडेंट और इंडिपेंडेंट को देखना है. दूसरा एक्सरसाइजिंग मसल को देखना है. अगर एक्सरसाइजिंग मसल है तो इसमें इंसुलिन इंडिपेंडेंट ग्लूकोज एंट्री है. अगर सिर्फ स्केलेटल मसल है तो इसमें इंसुलिन डिपेंडेंट है. यहाँ पे हाइपोथैलेमस आएगी. इंसुलिन डिपेंडेंट और इंडिपेंडेंट, जो डिपेंडेंट है वो स्केलेटल मसल और एडिपोज टिश्यू में ज़्यादा जाती है, और अगर इंसुलिन इंडिपेंडेंट है तो आपने एक्सरसाइजिंग स्केलेटल मसल को देखना है. कन्फ्यूजन के लिए देते हैं, अगर वो नहीं है तो फिर हाइपोथैलेमस. बेस्ट डोनर फॉर ट्रांसप्लांट इज ट्विन, और मोनोजाइगोटिक ट्विन और डाइजाइगोटिक ट्विन. द आंसर इज मोनोजाइगोटिक ट्विन, क्योंकि मोनोजाइगोटिक की जेनेटिक कंपोजिशन सेम होती है. इफ द जेनेटिक कंपोजिशन ऑफ द मोनोजाइगोटिक ट्विन इज द सेम, देन देयर इज अ लीस्ट लाइकली likely that it will be rejected. Ectopic pancreatic tissue is called choriostoma. After hypovolema, thirst is increased by which of the following already discussed in angiotensin 2. Potassium sparing diuretics, option B is the right answer. Nothing to explain in this, simple clear cut MCQ. In the presence of ADH, the maximum osmolarity of urine is Isfeminic. I have uploaded a video on my channel regarding in the presence of ADH, in the absence of ADH, in the presence of ADH with maximum osmolarity, in the absence of ADH. I have discussed this MCQ in detail, and it will clear all of your concept regarding the ADH and the maximum osmolarity and the minimum osmolarity, maximum urine volume, minimum urine volume. यहाँ पे 1200 आएगी, because the maximum urine osmolarity is 1200, because this osmolarity is because of the interstitial gradient, and the gradient is 1200, not more than that. But if the question says, let for example you have created a hypothetical system in which the interstitium is 1600 osmolarity, then the maximum urine osmolarity will be 1600. That is actually checking your concept. It depends upon the gradient. If your maximum gradient is 600, so what can you expect the maximum osmolarity? 600, not more than that. 600. And that is the reason if you give furosemide, less 6, it decreases the gradient inside the interstitium. Let's suppose you are having 1200 gradient, it decreases the gradient up to, let's say, 800. Now, what will be your maximum osmolarity in case of furosemide or less 6? The answer will be 800 or 600. If the question says the person is using less 6 and the gradient is the interstitial fluid osmolarity is 800, so you will be expecting the 800. So over here the answer is 1200. Adult polycystic kidney disease autosomal dominant, while infant or neonate is autosomal recessive. In which of the following solution the cell will swell more quickly? The answer is 250 ml of urea. There's MCQ on my channel regarding the urea. What will happen if you put a cell in a hypertonic solution of urea? Cell will shrink, then swell and lyse. Regarding the concept, I have shared that on my channel. Patient underwent cholecystectomy. Third post-operative dyspnea hai, pain hai, or hemoptysis. Answer is pulmonary embolism. Female is on HRT for 10 years. Her sister died of breast carcinoma. What is she at risk of? Breast CN. There is a 40% increased chance for only if family history is positive. But if a patient is also using HRT, hormone replacement therapy, there is further increased risk. Last intracranial branch of facial nerve is nerve to stapedius. Role of epidemiologist is to prevention of disease. The role of epidemiologist is to prevent the disease. Regarding autosomal recessive, तो autosomal recessive में यहाँ पे आप one of the four sibling is affected. Well, there is a mechanism for that. You can see over here. If your one parent is having autosomal recessive disease and the other is normal, so the outcome will be, you see, 50% will be carriers and 50% will be healthy, normal. So if both of the parents are having autosomal recessive disease, autosomal recessive, but they are carrier, well, I will make a video on this autosomal recessive carrier, autosomal recessive disease. But over here you see one person is affected in autosomal recessive, so you have the two are the carrier and the one is a healthy. But this is for those in which two of the parents are the carrier for autosomal recessive. Well, don't confuse yourself. I will make another video on this autosomal recessive, autosomal dominant. So you right now you pick the answer B. During CVP, the which structure is demarcation? The answer is sternocleidomastoid. The two heads of sternocleidomastoid, the vein run in between, and you paste that. 50 years old male patient came with the right hypochondrial pain with spleen 10 cm below, labs showing 70,000 WBC. HB low, platelet low, and perhaps there is immature myelogenous cell transcription involved. So 9 to 22, this is Philadelphia chromosome, and the diagnosis is the CML. The bronchocephalic vein, the brachiocephalic vein are formed by the internal jugular vein and the subclavian vein. The internal jugular vein from above and the subclavian vein coming from this, so it forms the brachiocephalic vein, and the two brachiocephalic vein from the other side combined together from the superior vena cava. Aortic wall 80. Pulmonic wall 8 mm. Which of the following is responsible for actinium myosin bridging? The answer is calcium. Patient with mild hemorrhage, BP control. What will decrease after compensation? What will decrease after compensation? इस पे नोट करनी. जब compensation हो जाएगी तो क्या decrease होगा? Heart rate decrease होगी. और क्या increase होगी? Urine output. Opioid induced respiratory depression can be reversed with naloxone. Best route to administer antidote is IV. Regarding blood supply of visual tract, which of the following is true? The answer is central retinal artery supply the head of the optic neuron. So that's all for today. Thanks for watching.